I think the most critical lesson that we can take away is that many of the interventions that have been tried to improve gender equality in health have been at the periphery of the health sector. And we have been addressing issues that try to change men and women in communities so that they're more empowered, which is a good thing. But we haven't been addressing the systems that they live in so that they are working better for the women and the men and the communities. So there's a real lack of attention to try to provide better services, health services, especially for women, improve technologies that would be more women friendly. There's a real lack of working with governments to improve how governments do policies that are more women friendly. I mean, there are a lot of policies, but they're not always enacted. So we have policies against gender-based violence. We have policies about equity to poor women or ethnic minority women getting services, but those are often not implemented. So the real lesson learned is that women generally, but especially women who are marginalized and disadvantaged, are really losing out on getting what they deserve from the health services that are being administered currently. And we are really short of lessons on how to do that well. It's really shocking that after 20, 25 years of feminist advocates saying that gender data in health needs to be sex and gender disaggregated, that we still don't do it for simple things. So, for example, recently there was a very interesting study done on how piped water or clean water in health facilities can reduce infections or improve the kind of services that men and women get, but it didn't disaggregate by sex. Now, this is crazy because you know that women coming to get health services are coming often in situations where the need for water is especially great. So, for example, a woman delivering a baby, right, needs clean water more than in many other situations. Also, women often accompany family members to take care of them when they're sick and they need water to either give them food or drink or take care of themselves. They have more sanitation needs. And then women workers, most health workers are female, and do they have access to water? And we still don't collect and analyze data to say what's the difference for women versus men on something like the provision of clean water at health facilities. And even if we do collect that kind of data, we don't analyze it. So a glaring issue, for example, is with the COVID vaccine. Sex disaggregated data was collected, but most often we're not using how the vaccine is working differently for men and women. We're not using that data to inform ourselves. I think that in many ways, the COVID pandemic, the devastation it has caused on so many fronts, has also been very helpful in bringing out the very disproportionate impact on women from health crises and health challenges. So, who has not heard about the enormous sacrifice and work that women health workers are doing across the world, and in many cases under horrible, horrible circumstances. They're overburdened, they're underpaid, they're doing the bulk of the work, and in many places they didn't even have protective gear, and they were doing that. And that coming to the forefront has been a very good thing, because we have known for a long time that the health workforce is very gender imbalanced in terms of leadership, in terms of getting paid, in terms of decision making. All the work is being done by women, and a lot of the leadership and the decision making is being done by men. And that has really, really come out front and center. And I really have a lot of hope that this whole issue of gender differences in the health workforce will now get much more attention than it has in the past. And similarly, I think we are also starting to understand that the differential impact of technology and access to digital health or access to information digitally or the kinds of vaccines and medications we develop, whether it's for birth control or whether it's for menstruation or whether it's for erectile dysfunction or whether it's for COVID, really has a very strong gender dimension, and that we should be looking at that. The research needs to be much more sex disaggregated, gender disaggregated. I think that has become very clear. So I have a lot of hope that both feminists and people in the health sector are going to be tackling these problems with much more interest and effectiveness than they have done in the past.